that mean? It's a neuropathic pain due to thalamic lesion, initial paresthesia followed in weeks to months by allodynia. It's basically ordinary painless stimuli causes pain. What does that mean, folks? So let's say I had a stroke in January. Now, let's say normally when somebody do this, it doesn't hurt. But after that first stroke, now even if somebody touches, it hurts me. Okay, that's that central post-stroke pain mean. That orderly, painless stimuli causes pain, folks. Does that make sense? So if you notice that elderly people, they are very sensitive after stroke. After that, even if you hold their hand a little tight, they scream saying it hurts. This is because of this. Okay, so that's the idea. It's basically the sensation all have altered after the stroke on the contralateral side, and it occurs in 10% of the stroke patient, not all of them, but that's that. Phantom limb pain, folks, okay? Sensation of a pain in a limb that is no longer present. So basically, let's say I have a patient, we amputated the leg. So that means the patient don't have a leg, but they can still feel the pain in their leg. It's an imaginary pain in the brain, folks, okay? Because that means the brain still feel the leg. Is everybody clear, folks? All right. Common after amputation, associated with reorganization of primary somatosensory cortex, characterized by burning, aching, and electric shock-like pain. Okay, that's the idea, folks. That's the amputation. Which type of patient most commonly get amputation in the hospital? Diabetic people. You know, that it is very sad. I don't like to talk to those patients before they go for surgery. Sometimes the surgeons don't want to deal with it. We had a patient, we amputated one leg, and after a month, we have to amputate the second leg. And my surgeon is like, I mean, she knows that she is going through the amputation and stuff. So the day of the surgery, you need to go, they have to sign the paper. And, you know, that's the worst part, folks. These people will cry, and it's sad because, you know, once you lose both of your leg, it's a sad part, but diabetes, right? So now that's phantom limb pain. Next, diffuse axonal injury. This is one of the most dangerous trauma people can get in a motor vehicle accident. Okay, it's a traumatic sharing of white matter track during rapid acceleration and deceleration of the brain. Okay, so basically what happened, folks, you know, sometime when the accident happened, it's a force that hits your head, right? That's the key. Usually result in devastating neurological injury, often arousing coma, persistent vegetative state. When these people have the diffuse axonal injury, they become a vegetative state. What does that mean? They will be in the bed forever with a ventilator. That's all it is. They will never come back. 300% will never come back, because once your axon is separated, there's no degeneration. There's no regeneration. Is that clear, folks? So that's the idea, okay? Now, if you think about it, when they invented the airbags in the car, right? Airbags can cause more injuries too. That's more common for injuries, folks. I don't know if you ever experienced an airbag. That thing hurts when it comes and hits your face, okay? Airbags are more powerful. It comes and hits you at 90 miles per hour speed. That's how it hits you. But why do you think they brought that airbag? Because when an injury happens, the airbag comes so fast to your face, isn't it, folks? It's okay to hit the face, but what it does, airbag, after hitting the face, it keeps the head in one position so you don't get this acceleration and deceleration of the head. That is the main idea, actually, they invented airbag. Because they want something to hold in one position, because during the accident, you don't want the head to go front and back. Does that make sense, folks? All right. That's the idea. So that's diffuse axonal injury. Once I was working on an ER, I still remember, there was a car accident. The girl was sitting in the car passenger seat. She had her leg on the dashboard, and the airbag deployed. How do I know that's exactly what happened? I saw her leg next to her head when they came to the ER. it actually breaks upside down. The worst thing, when you go in a car, you put your leg on the dashboard and bend the seat, and people relax like that, right? That is the worst thing you do it, folks. Because when you have a leg, airbag hits this, it goes this way. You never do that. I used to do that until I saw that case. After that, no. After that, I sit like I'm in a parade, like legs is on the floor. I don't move it even if I sleep. No, it is because of that speed. Is that there's nobody can hold that speed. They said it breaks to the opposite side, right? It's careful. All right. So that's diffuse axonal injury, folks. Next, aphasia. Now let's talk about the brain a little bit here. Now this is two areas. This is Wernicke's and this is Broca's. Wernicke's is around temporal lobe and Broca's is around frontal lobe. Okay, frontal and temporal, that's the idea here. Now I'm going to talk about the physiology, normal, okay. I call Wernicke's is your headphone. What does headphone mean? We listen and we understand what we say, hear it, isn't it, folks? So comprehension is your Wernicke's. So when you are listening, you understand. When somebody asks you a question, you understand it. That's your Wernicke's. Now that's only listening, folks, okay, not seeing it on the paper, okay, not seeing it on the paper. Once they understand, right? So let's say I ask a question. Once you understand the question, that tells you your Wernicke's area is working properly. Is that clear, folks? Then you think, you come up with the answer, then you know the answer. In order to say the answer, what do you have to do? You have to form the word in your mouth, isn't it, folks? Then we send the signal to Broca's area. Once it goes to the Broca's area in the frontal lobe, all they do, they form the word. I call it a microphone. So you form the word and you talk. Is that clear, folks? Right? So comprehension and word formation, that's Broca's area. Is everybody clear, folks? Who connects the Broca's to Wernicke? It's called arcuate fasciculus. Arcuate fasciculus, okay? This is the word, basically. It's like a wire that connects the Wernicke's to Broca's, folks. So when somebody understands something, that's what. Now remember, this is different. Like, for example, if I ask a question, somebody understand the question, they could write with their hand. That has nothing to do with the Broca's. Broca's is only for word formation. Is that clear, folks? All right. So that's that, okay? Now, that's a normal function of Wernicke's and Broca's. The last thing to learn, who supply oxygen to this area? Two areas. Which artery supplies? Let's see how many people knows that. There's a Wernicke's and Broca's. One is a temporal lobe, one is a frontal lobe. Two different lobes, isn't it? So that should be two different arteries, right? The answer is very atypical. It's one artery, MCA, middle cerebral artery. Only one artery supply both. That's how it's created. So middle cerebral artery is responsible for both Wernicke's and Broca's. This is important because when you have a middle cerebral artery obstruction or occlusion, headphone and microphone both are gone. Okay, that's the idea, folks. So you need to know that. So that's the basic anatomy. Is everybody clear? All right, go take a break. When you come back, we're going to start aphasia.